What has led to you getting to the spot you're in today here?
Well, I have a long background in healthcare. I started as a nurse, and I most recently came out of the Portland market where I led not only a community hospital but a regional level 1 trauma center. So I have a lot of experience in hospital operations, but I also come with a clinical background, which is really helpful when you're talking about delivery of care, quality of care, and trying to improve services for a community.
Why Bay Area Hospital?
Wow. I chose this community and I came down here actually to retire. And I wanted to help out at the hospital. And when I got in here, I started helping the executive team on some strategic priorities. And the more I got to know the people here, the more I got pulled back into the energy of healthcare. And because of my background and experience, I just naturally sort of picked up and assumed roles. And then I really wanted to save this community hospital because I'm a community member. I chose to move here and make this my home. And I really wanted to make sure there was outstanding clinical care that not only for myself, but for other community members here. And I felt like I had something to offer.
How long have you been in the community now?
I arrived just a little less than 2 years ago.
I think that was important for them to get somebody who they knew was going to stay, because I know that the last CEO took on an interim role. So you mentioned this is your community and you want to save the hospital. One of the many, issues kind of going on are the conversations with the Bank of Montreal. And I know that loan is massive. As you're kind of taking your role in here, what have conversations with them or other institutions, what have they looked like?
Well, the conversation with the bank is really around our recovery plans. How do we turn the financial picture around for Bay Area Hospital? How do we recover and get on stable ground so we start earning a profit so they feel more secure with their investment in us? I was responsible for more of the support services for the hospital, and I also worked with the physician medical staff development arena.
Gotcha. Okay. All right, let's get into the big questions here. The hospital is operating at a massive loss, and the main question that the community has is, how do we continue to work here with the loss that we're dealing with?
Well, we got to correct that, and part of that starts with taking action. And what we have already implemented is a reduction in force. So we've looked at positions that we no longer need in our organization, and we looked at our volumes and what is the right complement to be able to deliver the services that we've committed to providing for this community. And so we're sort of right-sizing our hospital. We did that through attrition, and then unfortunately we did that with some layoffs that had to occur. We also have gone through a laborious process of reviewing every single contract and every single basically expenditure and deciding whether we need that still. Could we ask for a reduction from whomever we were getting those services for? So we pulled back some cost out of our bottom line. And then on the growth side, we're looking at where we can add physicians, because ultimately you can't cut your way out of this problem for this community. We have to grow services. We have to bring providers to this town so we can expand services so people can stay local and get their healthcare here at Bay Area Hospital. Because there are some people who have to go out of the community to get services. And if we can work on the workforce, the physician workforce in particular, and adding those services back that might have been here in the past or we could put here for the future, that will help us regain our stable footing. So we've got cost improvement, we've got growth that needs to happen, and then on the third front, we're looking at how do we go after our payers, the insurance arm of this, to get increased funding for the hospital. So we're going back to the commercial payers. We're going to be talking to them about our rates so that they can provide improved rates for us. So we're kind of looking at all aspects of how we put this together and improve so we can be here into the future.
You mentioned some staff reductions. Other than the COO position that you previously held, what other positions have you maybe had to let go of or lay off?
We've let go of some support area positions. There are some positions that have mandated staffing rules. So we had to be really careful that we kept the staffing that is mandated, and we make sure that we have the right nursing complement and the right staff that is designated to be here. But then we looked at other additional positions. So we actually let go of some off-campus remote positions that were doing some support for billing. We eliminated some support positions in the hospital. In total, it was about 90 FTEs. But as I mentioned a little bit early in our conversation, not all of those were actually impacted people. We were successful in like planning ahead and reducing through attrition. So as people left the organization, we chose not to fill those positions.
Gotcha. So it wasn't just, hey, 90 people let go.
Exactly. In fact, I would say more than half of those 90 positions were able to be done by attrition. And we also offered up an early retirement option for some employees. And there were a few people that took advantage of that. They were thinking about retiring. And so we put together an opportunity for them to leave the organization a little bit earlier than they would have planned. And by doing that, they were able to save a position for somebody else in the organization. So we asked for volunteers, and there were some people who chose to volunteer.
I think in my previous coverage of the hospital, they mentioned a $30 million turnaround plan. And that was in place for a little while before you came in now. Now, are you planning to add to that? Do you have your own plan in mind? Or what's going on in terms of how the turnaround works?
The $30 million turnaround is still a really critical piece of our success, and we need to do that. We're about halfway there with some of our planning. We've got ourselves a little more than halfway there. We're probably about 20 million of the $30 million there. So we're expecting to see quite a bit of improvement immediately to our bottom line. But then a lot of the work around growth and development still has yet to be done. So that's the actual exciting part of this work, is really getting to frame up what is our growth plan. How do we continue to add services to this community? And that piece has yet to be done.
How did we get to that 20 million other than just the work with maybe not re-signing people to their positions?
We got there through additional expense reductions through contracts and services that we had contracted for the hospital, so we adjusted some of those. And then on the reimbursement side, looking at efficiencies, are we capturing all of the revenue? So we're working with our billing company to make sure that we're actually getting all of the revenue that we should be getting. And so some of that $20 million was tied up in improvements to our revenue cycle process.
Gotcha. There's a lot of concern among regional health facilities nationwide, just closing and losing out certain programs and things like that. So how are we navigating through this right now? Are there any cuts to Medicaid or more staff reductions maybe planned in the future?
Well, it's a really dynamic time. I mean, it's uncertain. With the big, beautiful bill, there's definitely threats to reimbursement, especially for Medicaid population, and we're very concerned about that. There are some rural transformation dollars that may be available to help rural communities such as ours keep access for our critical population that needs to be able to receive care. But we don't know yet what that's going to look like. The details of that are a little uncertain. The state has to apply for those funds to the federal government, and then the federal government has to approve that. And then the state has to have their own process for awarding those dollars. And so that is a little bit of hope for rural communities, but we are all very concerned about the future of healthcare. It's becoming very challenging. There's increased costs from legislative changes, as well as decreased reimbursements. And there's a lot of concern because denials are increasing from our payers. Every possible way to capture every dollar that we need is critical and essential, and we have to be very efficient at what we do to be able to be successful in this market. So I don't know if I answered that question very well.
You did great.
Did I do all right?
If I were to ask you point blank, how do you feel about the future of the hospital? What would you say?
I'm concerned. I'm concerned, but yet I'm hopeful, because We have a commitment and we have a mission to serve this community and this population, and we want to be here. This community needs a hospital. It absolutely has to have a hospital, and that is critical. So we have to find a way to make sure that our services can be here. And so, yes, I'm concerned, and that's the reason why we need to take action, and we are taking action. We have started down the path of executing our plan, and we're going to continue to carry it forward because we have to be successful.
Now, at the board meeting, one thing that I have to do as a journalist is focus a little bit more on the negative sometimes. And one of the things I noticed is, hey, we have a plan A, right? Plan A is save the hospital, and if all of this goes right, we don't live in that world always. So plan B mentioned a possible reduction in downsizing in the beds. Is that kind of the last resort situation for the hospital?
It is. So we developed a plan B because we need to be forward thinking and we need to make sure that we're still here for the basic services for this community. So we needed to have a plan B, but that is only if we can't fix our operations. Reducing the hospital to a type B hospital would mean we'd have to cut some services, and ultimately patients would suffer. If we were to remove services from this community, I think that the morbidity and mortality would increase, and that's not good for anyone.
What is a type B hospital?
A type B hospital is a hospital that's less than 50 beds, and it's a designation that Oregon has for Medicaid reimbursement.
How do you feel about the support you've been given through your few weeks now in that nice chair over there?
I feel really inspired and hopeful. The community members, the leaders in the community have been really welcoming, and not only just to me as a professional, but they've been excited to figure out ways that they can help the hospital. So I've had reach outs from North Bend Medical Center, Bay Clinic, the Coquel Wellness Center, our CCO, and other hospitals and clinics around the area. It's been wonderful already in just a short period of time. Everybody wants to offer their help. They're very hopeful as well, and they want to partner to find solutions so that we can be successful. And that's great. I mean, it's wonderful to have that kind of support. And even though I said earlier that I'm concerned, when you have that many people pulling for the hospital, it's inspiring and it brings a lot of hope.
What is your leading style here? Are there any changes that you see that need to be implemented right away that maybe haven't been looked at by other people that were in your position previously?
I don't know if I could say that there are things that haven't been looked at, but my style is very collaborative, and we have to focus on our finances because we have to recover, but my priority and my passion is around people and looking at how we deliver the best quality care we can, how we can make it the best experience for our community so they choose to receive their care locally. Additionally, I want to spend a lot of my time supporting our physicians and our staff. They're our most valuable resource here at this hospital. And rebuilding the culture and investing in our teams is what really will make the difference. They're the ones providing the outstanding care and advancing the services here in this community. And so my priority is building that culture back for the hospital, investing in our employees and our physicians so that they can deliver the finest care possible to this community.
Awesome. Just a few more and then we'll be out of here. I know when Kelly came in, he brought with him a chief financial officer, chief marketing officer. I remember in the meeting there was some words about somebody not remaining on board. Are you filling any, I guess, not vacant positions, but are there any roles being changed up now that you are the head of the hospital?
I am bringing in a CFO. I've hired a CFO who will be joining us in about 2 weeks. He comes with a lot of experience, and that's a critical position that we need here. We've also hired a CMO. Previously, that role was full-time. We've decided to make it a part-time position, and we've selected a physician who's part of our community. So that provider will also be working here at the hospital, as well as providing a chief medical officer position on my team. So those are the key roles. I'm still looking to replace our chief nursing officer position, and we have a recruitment process underway, and we have a couple of great candidates that we're going to bring to the community and see if they're the right fit for us. Hopefully those will work out soon. We have a great interim person in that position right now, but it's really great to build out the whole team. And I also have relied heavily, and I've kind of moved the chairs around a little bit on the entire team so that leaders can take on more responsibilities without having to hire any additional positions.